If you're new here, welcome. My name is Whitney and I'm a dental hygienist. If you've been here before, welcome back. It's still me under all this PPE. Let's talk teeth.
So first things first, you will definitely have a COVID-19 screening process, most likely before you're even able to enter the building. The front desk will probably call and ask you screening questions over the phone prior to you scheduling your appointment. These will be questions regarding your health and COVID-19 exposure history. Once your appointment date arrives, you may be asked to wait in your car and call the office once you arrive. It is suggested to not be using the waiting room right now to limit the number of people in the same area at once. However, if you are able to safely wait in the waiting room while social distancing, you may be asked to wear a mask. So, on your scheduling phone call, your office will explain how and what they expect you to do. Once you enter, you may notice a new fiberglass-type plastic barrier between you and the front desk. You may also be asked to wash your hands and/or use hand sanitizer right away. In addition, you will most likely have your temperature taken before you're even brought back into the clinic area as well. At some point, maybe even while you're getting your temperature taken, you'll probably be asked the COVID-19 screening questions once more. By the way, only the patient with an appointment will be allowed back into the clinic area, so no bringing your significant other or a friend or anyone to come sit with you in the room. Once the patient is brought back to the clinic side, they may be asked to first swish with a PreRinse. It will usually be hydrogen peroxide based. After swishing with the PreRinse, you're then ready for your appointment to start. The dental provider may be sporting a very different look than you're usually used to. If you're interested in seeing all the layers of PPE that your dentist and dental hygienist may be wearing, I'll link that video in the bottom bar below. Also, your appointment itself might be slightly different than you're used to as well. For example, you might be asked to wear more than the regular patient safety glasses, such as full face goggles, and/or a mask to cover your nose, or even a face shield during the appointment. During your cleaning, you might also notice that some clinicians may use hand instruments, the scalers only, the whole time. Or if they use an ultrasonic scaler, they will pair it most definitely with some type of high-speed suction, either a bite block type suction or a regular high-speed suction. Either way, a lot more suctions will be used. So the regular old school saliva ejector is not the only suction anymore. So just be aware of all the extra suction sounds you might hear during your appointment. You might also notice that your dental office now has filtration systems installed, and sometimes these air purifiers, filtration systems are yet another additional background noise you might be hearing. Again, the intent of this video is to prepare you and tell you about what to expect at your dental appointment, not to stress you out about all the new sounds you might hear. After the appointment is over, you most likely will be asked to put your mask back on before you enter back into the waiting room. The front desk protocols might be changed as well, such as payment methods and scheduling might be switched to over the phone or digital, so there is less passing of pens and paper around, the things you have to touch. Or they might even have a basket with clean, disinfected pens and another basket for the used pens. Whatever the case, we are all doing the best we can with the knowledge we have.
I hope this video gives you a glimpse into the potential new normal, lack of a better phrase. I'm not sure how I feel about that phrase yet. But truly, the purpose of this video is so you're aware and it's not overwhelming when you first step foot back into your dental office. Please remember that these are the interim guidelines for dental offices, meaning they can change because we are currently in an ever-evolving situation. So it is possible I will be making future supplemental videos as things progress. Until then, stay safe, wash your hands, and peace, love, and teeth.